20 years ago, the malaria situation accounted for about 1 in 5 of all deaths in young children in Kenya. That was, a pretty horrific position to be in. In the mid to late 90s, malaria became recognized as a major sort of international issue.
About 28 million Kenyans live in areas that put them at risk of malaria. And the government of Kenya, through the Ministry of Public Health and Sanitation and the Division of Malaria Control, and our various partners have come together to put in place interventions to try and reduce this risk.
Malaria is such a big problem for Kenya that no single partner can tackle it or effectively manage it on their own. If you want to walk fast, walk alone. If you want to walk far, walk together.
Global Fund has contributed significant funding. US government, WHO, UNICEF and others. DFID then allocated significant funds towards fighting malaria in Kenya. To date, we have spent £60 million on supporting distribution of insecticide-treated nets. So they're now distributed in all malaria endemic areas in Kenya for free to pregnant women and young children.
Here we are in the antenatal clinic. It's the point at which expecting mothers come for services. We deal with distribution of insecticide-treated nets, targeting the pregnant women and children below the age of 1.
Every time a client comes, a new facet, we issue a net.
At the first contact.
Even if they come at 40 weeks, we give them. And also the kids, they come after 6 weeks. We don't consider whether the mother was given during pregnancy. Now we give for the other 1 year.
Do you think that this program has created any impact in terms of malaria intervention?
Cases which were coming so many for malaria, they have gone down.
What you see here is a reflection of what is happening in the country. The free distribution of nets is really saving lives by decreasing malaria cases in the Republic.
Not everyone has access to the fixed health facilities. And so we've also developed community outreach programs, not just provision of the service, but also demonstration on education on how to use these services.
This is a community session. So we come and have a community talk to try and address what are the solutions that you would be able to offer yourself to be able to make sure that you're sleeping under a net every night.
Ni nini kinakufanya usilale chini ya neti kila usiku?
Nikijifunika hivi, kifua kinavuta dawa, nitafanyaje?
Ukitibu ile neti yako, ile dawa unafaa kuianika nje kabisa, ile neti ikauke. We had to look for community-based people working within their own communities and solving these issues. One of the reasons someone is not using the net is probably the house structure. So what we do is we take a walk with them into their own homes and show them how to hang that particular net. Going into the community is really, really important because that's where the problems are, and they can only address their issues by going directly to them.
The other intervention is to provide effective treatment for those who are already sick. Malaria treatment recommended by the World Health Organization at no cost.
I'm the nursing officer in charge at the Nyanza Provincial Hospital Pediatric Unit. When a child comes in and the mother thinks the child has malaria, the child is seen by the clinician who will order for a blood slide. Once the test has been done, it is positive for malarial parasites. The children are started on treatment immediately. If it's a child who is generally stable, the child is given ACT. ACT compared to the other types of drugs is much better. Once they are treated for malaria with ACT, then they don't come back. And the drugs they get free, so there are no challenges of not being able to buy the drugs or something like that. As a Kenyan nurse, and especially a nurse working with the children, ACT has really done a lot of good to us. Our children get better faster. They don't have to be in the ward for a long time. And they don't die as much as we used to have death cases in the past.
The progress with malaria control in Kenya has been very good. They are not burying children like they used to bury children.
We're seeing hospital admissions due to malaria reduced by half in some parts of the country.
On the Kenyan coast, you've seen a fantastic drop in disease rates, such that we can't actually do clinical trials now of vaccines and drugs because we don't have enough cases. The Kenyan government has to sort of stick its hand up and say, well, this is a result of what we've invested in.
The risk of malaria has reduced, but the risk is still present.
So we're not there yet, but we're going in the right direction. In order to achieve a malaria-free Kenya, what we need is everybody sleeping under a treated bed net. We need to make sure that everybody has access to a drug that works if they have malaria.
As a Kenyan, when I think of a future Kenya without malaria, I envision this to be as a Kenya whereby we have healthier born babies because of no incidences of malaria during the course of the pregnancy. As a Kenya where children in primary school are not missing days out of their learning or out of their play and out of their fun activities because of malaria. A Kenya whereby we do not necessarily lose my nephew, my niece, because of a very easily preventable illness, and that is malaria. If we sustain the momentum and in fact increase the efforts that we are doing as partners, a malaria-free Kenya is totally possible.